GSK's Exdensur, depemokimab, approved for asthma and chronic rhinosinusitis in the UK. A game changer? The battle against respiratory diseases has just gained a powerful new ally. GSK's Exdensur, a groundbreaking biologic, has been approved in the UK for two critical conditions: asthma with type 2 inflammation and chronic rhinosinusitis with nasal polyps. This approval could be a turning point for millions, but it's also sparking debates in the medical community. Unlocking new treatment options. Exdensur is a game changer for patients with specific respiratory issues. In the UK, it's now approved as asthma treatment for adults and adolescents aged 12 plus with type 2 inflammation and an eosinophilic phenotype, who aren't controlled by high-dose inhaled corticosteroids and another asthma controller. Chronic rhinosinusitis therapy for adults with severe nasal polyps when systemic corticosteroids and surgery aren't effective. Clinical trial success. The approval is backed by the SWIFT and ANCHOR Phase 3 trials, which demonstrated impressive results with a twice-yearly dosing regimen for depemokimab. These trials achieved their primary goals, showcasing statistically significant improvements when adding depemokimab to standard care. But here's where it gets controversial. Kaivan Kavandi, GSK's SVP and Global Head of Respiratory, Immunology and Inflammation R&D, believes this approval could redefine care for millions. But is this optimism justified? The data shows a 54% reduction in asthma attacks over 52 weeks and a 72% reduction in attacks requiring hospitalization or emergency care. However, some experts argue that these results, while promising, should be interpreted with caution. Potential impact on healthcare. Asthma affects millions worldwide, and many continue to suffer symptoms despite treatment. Exdensur's ability to reduce asthma exacerbations and manage chronic rhinosinusitis symptoms could significantly improve patient outcomes. But the real game changer is its potential to ease the burden on healthcare systems, which bear the brunt of asthma-related emergency visits and hospitalizations. Trial details and safety. The SWIFT trials showed a substantial decrease in asthma attacks, while the ANCHOR trials demonstrated improvements in nasal polyp scores and nasal obstruction. Across these studies, depemokimab was well tolerated, with side effects similar to placebo. Global regulatory progress. Depemokimab is making waves globally, with a positive CHMP opinion in the EU and ongoing reviews in the US, Japan, and China. Decisions are anticipated from December 2025, marking a significant step towards broader access. Understanding the conditions. Asthma with type 2 inflammation. This form of asthma affects millions, and many struggle with symptoms despite treatment. Severe asthma requires high-dose inhaled corticosteroids and a second therapy to prevent uncontrolled symptoms. Type 2 inflammation, characterized by elevated eosinophils, is the culprit in most cases. Chronic rhinosinusitis with nasal polyps, CRSWNP causes debilitating symptoms like nasal obstruction and loss of smell. It's driven by type 2 inflammation in most cases, leading to severe disease and tissue remodeling. The science behind Exdensur. Exdensur is a biologic with high interleukin-5, Illinois 5, binding affinity, a key player in type 2 inflammation. Its extended half-life allows for twice-yearly dosing, offering sustained efficacy. Trial publications and presentations. The SWIFT trial results were presented at the 2024 European Respiratory Society International Conference and published in the New England Journal of Medicine, while the ANCHOR trial results were showcased at the 2025 AAAI and WAO Joint Congress and published in The Lancet. Ongoing research. Depemokimab is being studied in Phase 3 trials for other type 2 inflammation-related diseases, such as eosinophilic granulomatosis and hyper-eosinophilic syndrome. GSK is also investigating its potential in COPD with type 2 inflammation. GSK's respiratory focus. GSK is dedicated to advancing respiratory medicine, aiming to improve outcomes for asthma and COPD patients, as well as those with less understood conditions. Their innovative approach combines vaccines, targeted biologics, and inhaled medicines to tackle the root causes of respiratory diseases. About GSK. GSK is a global biopharma leader, driven by a mission to unite science, technology, and talent to combat diseases. Forward-looking statements. GSK reminds investors that forward-looking statements are subject to risks and uncertainties, as detailed in their annual and quarterly reports.